I have a few stories to tell you. Jen always wanted a large family. But when she was delivering her first child, she developed a postpartum bleeding. To survive, she had to have a large surgery removing her uterus. That led to a long recovery and loss of ability to have more children. Ryan. Ryan is a young veteran. During the combat in Afghanistan, he had a back trauma. Now, he suffers excruciating, ongoing pain that interrupts with his everyday living. He's taking painkillers. Ryan never thought that him, strong-willed, brave young man, will be addicted to a substance. He never realized that he could be part of a national opioid epidemic. Dan is a successful lawyer. Last month, he was diagnosed with liver cancer. If he's lucky and his tumor is small enough, he can have a liver transplant. To maintain a new organ, he would have to go on a lifelong immunosuppression. If the disease is too advanced, he'd have to go through long courses of chemotherapy. Infection, bleeding, hair loss, fatigue, and upset stomach are all waiting for him. But what if those were not the only options for Ryan, Jen, and Dan? What if Jen can have uterine artery embolization? A 45-minute procedure with only pinhole incision in her wrist or groin. A catheter that is not much larger than a needle can be guided to the site of bleeding. There, the vessel that supplies uterus can be closed off with a coil or glue, and the bleeding stops. That could save her life, could prevent from a major surgery, and potentially, she can have more children in the future. What if Ryan has nerve ablation and vertebroplasty? Through a tiny skin nick on his back, a probe, thin probe, is directed to his vertebral body, where heat destroys the nerve endings. Then, the fracture is stabilized with the injected cement. He can be pain-free the same day, and he can start his civil life with honor, dignity, strong self-esteem, and full functionality. What if Dan has microwave ablation for his tumor? A thin probe would be directed through the skin directly to his liver, and there the heat destroys the tumor. This 1-hour procedure can potentially be curative. Even if the disease is too advanced to have surgery or ablation, a catheter can be guided to his liver, and large dose of chemotherapy can be directed directly to the tumor. This would spare him from a lot of side effects of chemotherapy and significantly improve the quality of life. All of this sounds like a science fiction movie or some great ideas that may or may not happen in the next 200 years. Now, that's actually something we do every day in interventional radiology, already now. But why you never heard about it? It seems like interventional radiology has been the best kept secret of medicine. So let's change this. Let me try to break it down and explain what interventional radiology is. Radiology is a science of imaging. We use ultrasound, X-ray, MRI, CT scans to see inside the body without cutting it open. Interventional, the word interventional, it means that we don't just look, but we also intervene. We treat, we do procedures. Together, interventional radiology diagnoses and treats diseases in all body systems using minimally invasive, image-guided procedures. So how do we do this? We use the least invasive ways to target the disease. Through tiny incisions in the skin or vessel, we use wires and catheters to direct to the target organ, to reach the target organ. There, we use heat, cold, small particles, chemotherapeutic and radiotherapeutic agents, or intravascular devices to treat the disease. We can treat over 100 conditions: cancer, blood clots, bleeding, fractures, pain, prostate disease, uterine fibroids, and many, many more. We can open up the vessels to the legs, preventing amputations. We can treat stroke. Probably every one of you know a family member or a friend who had a stroke. You know how in one moment the person can go from their everyday life to being paralyzed, or losing speech, or losing understanding of what's going on around them. If the patient comes fast enough to our care, we can guide the catheter to the brain and aspirate the clot. Potentially, the patient can come back to his baseline function and continue his normal life. We treat all these diseases in close collaboration with all the specialties in medicine. We provide comprehensive longitudinal care to our patients. We believe that IR-operated procedures can provide the best patient outcomes and give some additional alternatives, life-changing alternatives to the patients. And it's not only on individual level that we decrease procedure time, we decrease medication use, we decrease risks of each of the procedures in comparison to surgery. We decrease the recovery time. So every patient can benefit from these procedures. And altogether, it's all decreasing the healthcare cost on a large level, on a national level. So we already know how interventional radiology is improving healthcare value already now. And its evolution is only in its dawn. We're still working with inventing new and new procedures. Clinically oriented physicians work very closely with engineers and technological industry. Every day, on an ongoing basis, we invent new devices, new procedures, and new ways to help our patients. Right now, we are trying to incorporate virtual reality, and artificial intelligence in our operating rooms. We are learning how to treat new conditions such as inflammatory diseases and obesity with the new minimally invasive ways. We learn how to use stem cells and gene therapy to restore blood to the legs and prevent amputations. The development of interventional radiology is great, and there is so much, there is endless potential for innovation and improvement of patients' care. But there are still some barriers we have to overcome. Due to novelty of many of the procedures, there is still not enough clinical trials, and we need to build bigger national registries. Some of the procedures, which are newer, are still not covered by insurance. There is lack of interventional radiology physicians in the smaller hospitals and rural areas. Some of the physicians from other specialties do not know the full spectrum what IR can offer, and that's why they do not refer enough patients to our services. And most importantly, patients do not know what treatment options they have. So this is something we're trying to change. So ask your physician what minimally invasive procedures is there to treat your condition. Ask what interventional radiology can do for you. Do believe in innovation and progress in medicine. And do believe in better medicine.